Bubonic Plague. Yersinia pestis, formerly Pasteurella pestis, is a gram-negative, non-motile, rod-shaped Coccobacillus bacterium with spores. It is a facultative anaerobic organism that can infect humans via the oriental rat flea, or the Synopsilla cheophis. And it causes the disease plague, which takes three main forms, which are the pneumonic, septicemic, and bubonic. So, overview. Yersinia pestis was discovered in 1894 by Alexander Yersin, a Swiss French physician and bacteriologist from the Pasteur Institute, during an epidemic of the plague in the Hong Kong. So, Yersinia was a member of the Pasteur School of Thought. Kitasato Shibasa Buro, a Japanese bacteriologist who practiced Koch methodology, was also engaged at the time in finding the causative agent of the plague. However, Yersin actually linked plague with Yersinia pestis. Formerly named Pasteurella pestis, the organism was renamed Yersinia pestis in 1944.
Okay, so moving on sa transmission. In this case of Yersinia pestis, there are two forms of infections. Rats are the natural reservoir, meaning the habitat where the bacteria normally live for the urban plague. Instead naman, squirrels, field rats, domestic cats, and rabbits are the natural reservoir for salvific plague. The way it works naman kasi is this. Bacteria maintain their existence in a cycle involving rodents and fleas. Fleas become infected during a blood meal from an infected rat. The bacteria will then replicate in the gut of the flea, and then the flea can transmit the disease into another creature when it goes for another blood meal on a healthy host. In general, the plague bacteria can be transmitted to humans through bites from an infected flea, through contact with contaminated tissue or fluid, such as a hunter skinning an infected animal without any protective gear, or infectious droplets from an infectious person's cough. But sa case naman ng US, infectious droplet contamination has never occurred, but it is more common in developing countries.
Clinical signs of bubonic plague. What causes bubonic plague? It is caused by buboes, a swollen inflamed lymph node. Without treatment, the bacteria can spread to the other parts of the body, such as under the arms or in the armpit. And lastly, in the neck. There are also other symptoms like fever, headache. In animals, there's nausea, abdominal, and back pain. But in animals, they can also have fever, headache, and the enlargement or swollenation of lymph nodes.
Diagnosis, techniques, and concepts for Yersinia pestis. Diagnosis should be considered in any patient with clinical signs and recent history of exposure in Western United States or any plague endemic area. Plague should be suspected in febrile patients who have been exposed to rodents. The clinical signs include fever, chills, extreme weakness, abdominal pain, diarrhea, vomiting, bleeding from mouth, shock, blackening and death of tissue, also known as gangrene, in the extremities, commonly in the fingers, toes, and nose. A bubo usually occurs in the groin, axilla, or cervical nodes. Buboes are painful that patients are generally guarded and have restricted movement. The incubation period for bubonic plague is usually 2 to 6 days. Drug therapy should begin as soon as possible after laboratory specimens are taken. Isolation of patients with pneumonic signs should practice to avoid droplet precautions. Diagnostic testing. Lymph node aspirate. An affected bubo should contain numerous organisms that can be evaluated microscopically. Blood culture. Organisms may be seen in blood smears if the patient is septicemic. Blood smears taken from suspected bubonic plague patients early in the course of illness are usually negative for bacteria by microscopic examination but may be positive by culture. Sputum. Culture is possible from sputum of very ill pneumonic patients. However, blood is usually culture positive at this time as well. Appropriate samples and specimens. Blood for culture, aspirates of enlarged lymph nodes for smear and culture, acute and convalescent sera for antibody levels, sputum for culture, CSF for smear and culture. Smears. Examined after staining with Giemsa stain and with specific immunofluorescent stains. Wayson stain may also show striking bipolar appearance. Cerebrospinal fluid and sputum smear should also be stained. Cultures. On blood agar, Macaulay agar, and in infusion broth. Growth on solid media may be slow, but blood culture are often positive in 24 hours. Tentatively identified by biochemical reactions. All cultures are highly infectious and must be handled with extreme caution. Other notes. If cultures yield negative results and plague is still suspected, serologic testing is possible to confirm the diagnosis. One serum specimen should be taken as early in the illness as possible, followed by a convalescent sample 4 to 6 weeks or more after the disease onset.
Next, we move on to the treatment and prevention of bubonic plague. So for the treatment, if in an area with the plague and have symptoms, make sure to visit the veterinarian or the doctor right away. The health expert may run different tests to confirm if a patient is positive with the bubonic plague. So if an individual comes in contact with another with the plague, the health expert may start treatment even if symptoms are absent. So common antibiotics are doxycycline, uh, tetracycline, chloramphenicol, and fluoroquinolones. So for fluoroquinolones, uh, the clinical trials are not yet sufficient, but growing evidence suggests that from their use of enzootic areas that they are effective in the treatment of plague in dogs and cats. So the recommended treatment period is around 10 to 21 days, and the duration of infectivity in treated cats is relatively unknown, but cats are observed to be non-infectious after 72 hours of treatment. So next is the prevention. So along with the treatment and diagnostic considerations, the protection of animals, and initiation of public health interventions is critical when an animal is suspected to have the plague. So rodent proofing the environment by getting rid of nest areas of rodents that may carry the disease is a must. And thoroughly cleaning the environment, getting rid of uh, by getting rid of fleas is another precaution one may take in avoiding the plague. And then lastly, keeping animals flea-free by applying products or drugs that may aid in prevention of infection of the disease.
Imagine if half the people in your neighborhood, your city, or even your whole country were wiped out. It might sound like something out of an apocalyptic horror film, but it actually happened in the 14th century during a disease outbreak known as the Black Death. Spreading from China through Asia, the Middle East, Africa, and Europe, the devastating epidemic destroyed as much as 1/5 of the world's population, killing nearly 50% of Europeans in just 4 years. One of the most fascinating and puzzling things about the Black Death is that the illness itself was not a new phenomenon, but one that has affected humans for centuries. DNA analysis of bone and tooth samples from this period, as well as an earlier epidemic known as the Plague of Justinian in 541 CE, has revealed that both were caused by Yersinia pestis, the same bacterium that causes bubonic plague today. What this means is that the same disease caused by the same pathogen can behave and spread very differently throughout history. Even before the use of antibiotics, the deadliest outbreaks in modern times, such as the ones that occurred in early 20th century India, killed no more than 3% of the population. Modern instances of plague also tend to remain localized or travel slowly, as they are spread by rodent fleas. But the medieval Black Death, which spread like wildfire, was most likely communicated directly from one person to another. And because genetic comparisons of ancient and modern strains of Yersinia pestis have not revealed any significantly functional genetic differences, the key to why the earlier outbreak was so much deadlier must lie not in the parasite but the host. For about 300 years during the High Middle Ages, a warmer climate and agricultural improvements had led to explosive population growth throughout Europe. But with so many new mouths to feed, the end of this warm period spelled disaster. High fertility rates combined with reduced harvests meant the land could no longer support its population, while the abundant supply of labor kept wages low. As a result, most Europeans in the early 14th century experienced a steady decline in living standards, marked by famine, poverty, and poor health, leaving them vulnerable to infection. And indeed, the skeletal remains of Black Death victims found in London show telltale signs of malnutrition and prior illness. The destruction caused by the Black Death changed humanity in two important ways. On a societal level, the rapid loss of population led to important changes in Europe's economic conditions. With more food to go around, as well as more land and better pay for the surviving farmers and workers, people began to eat better and live longer, as studies of London cemeteries have shown. Higher living standards also brought an increase in social mobility, weakening feudalism, and eventually leading to political reforms. But the plague also had an important biological impact. The sudden death of so many of the most frail and vulnerable people left behind a population with a significantly different gene pool, including genes that may have helped survivors resist the disease. And because such mutations often confer immunities to multiple pathogens that work in similar ways, research to discover the genetic consequences of the Black Death has the potential to be hugely beneficial. Today, the threat of an epidemic on the scale of the Black Death has been largely eliminated thanks to antibiotics. But the bubonic plague continues to kill a few thousand people worldwide every year. And the recent emergence of a drug-resistant strain threatens the return of darker times. Learning more about the causes and effects of the Black Death is important, not just for understanding how our world has been shaped by the past. It may also help save us from a similar nightmare in the future.